In this video, we'll discuss about rheumatoid arthritis clinical features. Rheumatoid arthritis is a chronic inflammatory disorder which is an autoimmune disease. So it is a chronic inflammatory disorder which is in autoimmune disease. This one most commonly affected in females. So maximum that age group 40 to 60. This rheumatoid arthritis is commonly associated with the gene HLA-DR4R, most strongly associated with HLA with rheumatoid arthritis, and another gene PTPN22 gene. These two genes are commonly associated with rheumatoid arthritis, and comparing to male, female mostly affected, maximum that age group 40 to 60. Next, clinical features. These rheumatoid arthritis are bilateral symmetrical involvement of smaller joints will be seen in rheumatoid arthritis. Bilateral symmetrical involvement. Usually they will spare distal interphalangeal joint. So distal interphalangeal joints. Next, this one, the characteristic presentation: when the person wake up in the morning, he have some stiffness, but when he start working, the stiffness will be relieved. When work, that time wake up time only, this one stiffness will cause. When he will work, that time relieved. Osteoarthritis with the work also aggravated. So this one working time relieved, but osteoarthritis working time also aggravated. This one is the bilateral symmetrical involvement of smaller joint, not larger joint, smaller joint. This one usually they will spare distal interphalangeal joints. Then wake up timing, it have stiffness. One working timing relieved, but osteoarthritis working time also aggravated. Next, there are three important findings with rheumatoid arthritis. One is swan neck deformities. Second one is Poutinier deformities. Third one is X-ray report. What is swan neck deformities? There are three findings in rheumatoid arthritis. First one is swan neck deformities. When you are seeing this finger, okay, here this one distal interphalangeal joint. Okay, this one is parasemal interphalangeal joint here. Okay, here this TIJ, this one having hyperflexion, this one having hyperextension. Okay, these are the main different. These swan neck deformities, this distal interphalangeal joint having hyperflexion, this parasemal interphalangeal joint having hyperextension. Second, this Fountainier deformities, this DIJ have hyperextension, this PIJ having hyperflexion. These are the main difference between swan neck deformity and Fountainier deformity. Next, when you will see that X-ray report of that patient, what is the characteristic finding you can find? There is a radial deviation of that wrist joint. So radial deviation of that wrist joint. Then fingers are showing ulnar deviation. So X-ray we can see this ulnar deviation and radial deviation in wrist. Next diagnosis. There are two things. One is biopsy, second one is serology. First one is biopsy. What are the finding you will observe in that rheumatoid arthritis? That one name is called as pannus. What is pannus? Pannus is the characteristic feature of that rheumatoid arthritis. This one is the diagrammatic representation of articular cartilage, swollen or edematous synovium, which will be presented. This is called as pannus. So pannus means swollen or edematous synovium which is presented. That name is called as pannus. What will be presented inside of that this swollen synovium? What are the things is presented? Inflammation. There will be having inflammatory cell, fibroblast and granulation things. Three things are presented. Inflammation, it having inflammatory cell, fibroblast and granulation tissue. These are the three things which are presented in pannus. What these are doing? These are overlying articular cartilage and causing their erosion, and after that there will be causing destruction of this articular cartilage. This is about we can understand articular cartilage. Inflammatory cell causing articular cartilage. Where ever see X-ray, there will be erosion of that bone. So osteopenia, erosion of that bone name is called as osteopenia will be finding. Another important finding in this biopsy, this rheumatoid subcutaneous nodules. What will be presented in rheumatoid subcutaneous nodules? Here we'll find granuloma. Okay, here we will found that granuloma. When we'll see that biopsy center area having fibrinoid necrosis. Okay, center area having fibrinoid necrosis. Around that fibrinoid necrosis, palasated macrophages are presented. This one is the macrophages. What is meaning by palasated? Means this one surrounded by palasated macrophages in rheumatoid subcutaneous nodules. So this one arranged in this parallel. So arranged in parallel. So it have that name fibroid necrosis surrounded by palasated macrophages. His name is called as rheumatoid subcutaneous nodules. So this one arranged in parallel. There are two characteristic biopsy finding in rheumatoid arthritis. Second one is these two. One is pannus. Second one is rheumatoid subcutaneous nodules. Next one is serological investigation. So that one presented in parallel. Okay. Second one is serological investigation. It having two important feature. First one is this IgM antibody which is formed against the fragment of IgG antibody. Second one is anticyclic citrullinated peptide is having specificity of 95% and this will be specific investigation to confirm diagnosis serology of rheumatoid arthritis. So two important serological features. First one is IgM antibody, which is formed against a fragment of IgG antibody. Second one is anticyclic citrullinated peptide having specificity of 95%. So this video discussed rheumatoid arthritis clinical features, swan neck deformities, Pontonier deformities X-ray report. Next one is diagnosis, biopsy and serology. In this one, two method. Then next one is serology. Here also two method. This one presented parallel. Thanks for watching.